This is Mercy Care Plan, a managed care plan sponsored by two of the most prestigious healthcare systems in the state, Dignity Health and Carondelet Health Network. 30 years later, Mercy Care Plan provides access to quality healthcare services for more than 330,000 Arizonans, working with more than 6,000 doctors and other providers of care. From a small health plan that limited its services to people living in just a few zip codes around St. Joseph's Hospital in Phoenix, Mercy Care Plan has grown to become one of the largest Medicaid plans in Arizona.
My first title at Mercy Care Plan was administrative intern. I was hired straight out of college. I was recently graduated from Indiana University, and that was in the spring of 1985. And we were pitching capitation to these doctors all over the state back in 1985. So it was cutting edge stuff. I was very excited about it.
We were doing everything on paper, and as we moved offices from one side of Central to the other side on Thomas, we lost the boxes with the reinsurance claims, which was a big chunk of the money we had coming in. We found them eventually, but that was kind of one of the hard parts of our move. In 1985, when we started Mercy Care, Medicaid was still relatively young, having been signed into law in '65, and Arizona was the last state. We waited 17 years to get a Medicaid program. And the question was this going to work? And was it going to grow? And I think all of us who were working in it felt really strongly that this was the way to go. What's interesting is the country has moved towards what Arizona did in the '80s. It seems to me that the commercial plans versus the mission-driven plans have done pretty well, but not nearly as well as the mission-driven, those with the heart. And Mercy Care, in my mind, remains a plan with a heart.
Mercy Care Plan grew from the seeds planted by the Catholic founders who knew the need and courageously expanded their mission. People like Sister St. Joan from Carondelet and Jack Buckley, CEO of St. Joseph's Hospital, came together in an unusual Phoenix-Tucson agreement that was not only risky, but unprecedented. But the person who was most often credited with guiding the new Medicaid plan through the murky political landscape was Monsignor Ed Ryle, who became chairman of the board of Southwest Catholic Health Network, the organization formed to sponsor Mercy Care Plan. In the late 1990s, Mercy Care Plan hit a tough financial road, and it was Ed Ryle who brought in Schaller Anderson to help manage the plan.
Ed brought to bear a unique background. Ed had been sent to Catholic U in 1960 to learn public policy and healthcare. Ed had an unquenching thirst for facts and data. And Ed came back to Arizona with an extensive background in understanding those policies and became the lightning rod for the Catholic Conference. And he was an untiring advocate for the poor and for the disenfranchised and had an incredible reputation. And Ed was premier in the ability to walk across the aisle and get people to do the right thing for the right reason.
Today, Mercy Care Plan not only serves the acute population, it also provides access to care for the developmentally disabled, people who need long-term care services, and those who are known as the dual-eligible population because they need both Medicaid and Medicare. Recently, Mercy Care partnered with the Maricopa Integrated Health System to launch a new regional behavioral health authority in Maricopa County, Mercy Maricopa Integrated Care, which is helping Medicaid members to access behavioral health services. For the first time, people who have been diagnosed with a serious mental illness are receiving integrated physical and behavioral health care.
I think the mission of Mercy Care Plan has always been very focused on the patient and even the patient's family. I think we have attracted very committed individuals who really care about doing the right thing for patients and doing the right thing in the most appropriate environment.
From a fledgling plan that served 5,000 people the first year to a plan 70 times bigger, Mercy Care Plan has grown far more than its founders could possibly have anticipated.
I think our early founders would be shocked today just to see the tremendous growth and the tremendous the tremendous opportunities now that our patients receive as a result of our commitment. I think they would be extremely proud
So one thing everyone can be sure of is that the mission for Mercy Care, the mission for Mercy Maricopa, and the missions of the hospital systems that sponsor these organizations will never change. And that is to continue to put the member first, take care of those individuals in our community that need the most support, and continue to provide access to quality health care for those individuals.
And I see into the future, our opportunities are endless. When I look at, now prevention and wellness as well as care, when I look at mental health and all of the new adventures there, and I look at the new opportunities with the exchange products and new products that are coming out in the future, I think our opportunities are endless, but our commitment is steadfast in making it the best Medicaid plan in the state of Arizona.